A brain aneurysm is a weak spot in the wall of the blood vessel of the brain. And if you imagine like a garden hose, which one side of it thinned out, it can bulge out. So it's like a bulge on the wall of the aneurysm. And there is a potential that it could expand and it could burst, causing significant and catastrophic brain hemorrhage. Also, some of these aneurysms, when they are picked up initially by a scan for any other reason, and when you watch it over time, some of the aneurysm can change and grow. So that is what we are looking for when we do annual surveillance scans. So it's basically like a bulge in the wall of the blood vessel. That's what an aneurysm is. And it can be in different locations of the brain. And depending on the location and where what the size is and what the shape of the wall is, we decide whether it's best to monitor it or to do something about it. Treating it, one can adopt a policy of wait and watch, especially smaller ones. And historically, we tend to say that 7 millimeter or less can be managed by surveillance. But again, that is an empirical value, and there's been some studies about whether the size influences the risk of rupture. We do think size also a significant factor, but not only the size, but other risk factors as well in terms of location and the irregularity of the aneurysm. So we take everything into account before making a decision. So wait and watch policy is one, especially for smaller aneurysms which are incidental. Second option is to consider endovascular treatment, where it is a minimally invasive way of treating this aneurysm from inside the body. It's done by interventional radiologists. So often when we discuss the treatment option, neurosurgeon and interventional radiologist join in for the consultation to discuss that option, especially if somebody is very keen to have it treated and is not wanting to accept the small risk related to some of the aneurysms. So we will have that kind of discussion. And the interventional radiologist then go up through one of the blood vessels of the body, inside the blood vessel of the body, using tiny microcatheters, which will go all the way up into the head, into the aneurysm, and it can, and we can then place very tiny coils to block the aneurysm and completely shut it off from the circulation. That technique is called coiling. And also, some of the aneurysms may need additional technique called stent, which is like a flexible mesh, which will redirect the blood flow away from the aneurysm and back into the parent artery. It's called fluid diverting stent. And sometimes you may have to employ a number of techniques, stenting and coiling. Also, sometimes there are new devices which will fill up the sac from inside. So these are techniques which are evolving and getting better, the technology. And often patients will need long-term follow-up after these sort of endovascular treatment. And many patients with a stent will require blood thinners for some time. And the other option is surgical option, where someone like me, like a neurosurgeon, make an incision on the scalp and remove a piece of bone and go and find the aneurysm directly and place a clip, like a metal clip or a titanium alloy clip, across the neck of the aneurysm, which will secure the aneurysm forever. Generally, this lasts for the lifetime, and generally we don't tend to follow patients up after a successful clipping. So that's one advantage, but it's an open procedure, invasive procedure, and the recovery is slightly more longer than the clipping procedure. But again, this is the kind of discussion we have to have jointly with the patient and the interventional radiologist and the neurosurgeon, because some of the locations are preferably treated with endovascular treatment, such as coiling or stenting, and some location may be, especially in some younger patient, and some location, it may be preferably treated with a surgical clipping. So these are the ways aneurysms are treated. Most of the unruptured aneurysms, they do not cause any symptoms at all. And we wouldn't know about them until it causes a bleed. But some aneurysms, some of the unruptured aneurysms, if it is near any nerves, like the optic nerve or other nerves, it can lead on to having trouble with the eyesight or having droop dilate or double vision. But generally, they are asymptomatic. But the ruptured ones, if the aneurysm ruptures, it causes a massive headache. It used to be described as a thunderclap headache, the worst headache of your life. So it's a very dramatic. It's like a bolt from the blue, and you would know about it. So these are the two ways the aneurysms can present. It could be an unruptured aneurysms. It gets picked up when you go for a scan for something else. Or also, it could cause a neurological problem depending on where the location is and what the size of it is. But also, some of the aneurysms can burst and cause a massive bleed or a minor bleed, but it can lead on to a significant headache and other symptoms. But once it bleeds, can lead to having loss of consciousness. Some patients get neck stiffness or having insensitivity to light. So these warning signs are quite dramatic, and that needs urgent medical attention. So the risk of rupture varies depending on the size of the aneurysms and where they are in terms of where in the brain they are and the shape of it, or whether there are any other additional medical condition that can complicate someone's medical situation, such as uncontrolled blood pressure, heavy smoking, and also some genetic conditions with your tissue in general. So these are some of the conditions that can influence the risk of rupture. But generally, the risk of rupture for an unruptured aneurysm overall is fairly low. But then we need to discuss about all these factors that will be taken into account when you discuss the risk of rupture. If you're looking at small aneurysm, we generally believe the risk of it rupturing is quite small. And there are some calculators, risk calculators one can use to look at the approximate risk of a rupturing. But again, that is not completely 100% accurate. So one has to look at the patient overall to decide whether an aneurysm needs treatment or not. No, not all brain aneurysms need treatment. The aneurysms that we think are of higher risk of bleeding or causing a neurological deficit will need a treatment. And often, many of the unruptured aneurysms, especially smaller ones, are managed very reasonably through surveillance. When I say surveillance, it's a careful monitoring with usually yearly scanning, and often you only need is like an MR angiogram every year to look at any change in the size of the aneurysm. And most of them do not change, but when you see change, sometimes that will be a major concern. Then we would strongly argument for treating it. But majority of unruptured aneurysms can be managed conservatively. But again, this is a joint decision by the treating neurosurgeon and the patient. So you cannot have a very strong view one way or the other, because you can never predict the risk of rupture 100% with 100% accuracy. Well, at least now, but hopefully in future, as we research more and more into this risk of rupture, which is a lot of work is going on and research is going on in this field, so we'll get to know and we can accurately measure the risk of rupture in future. So many patients with unruptured small aneurysms can lead a normal life. Obviously, you have to have a healthy life, make sure the blood pressure is under control. You don't smoke, because smoking is one of the risk factors we think about when we talk about aneurysms. And also excessive use of alcohol is another risk factor. Apart from that, because these are all, majority of them are incidental findings, they must have been living with this without knowing about it, must have been doing all sort of activities. But generally, once you get the diagnosis, generally you can carry on with this normal life, but to have a discussion about the options with the neurosurgeon and the best way to manage the aneurysms. But I would imagine most patients with small aneurysm can lead a normal life. Those who do go for any surgical intervention or any endovascular intervention after treatment, they should be able to lead a normal life. Screening is often recommended if there is a history of familial aneurysm. When I say familial aneurysm, somebody is known to have in your family, especially the first degree relative with a known aneurysm, had a bleed from an aneurysm, and then also if there is a strong genetic disorder such as autosomal dominant polycystic kidney disease or collagen disorders such as Ehlers-Danlos, and such conditions, it may be recommended to screen the family members. But generally, majority of these aneurysms, when they are detected incidentally, they don't need a familial sort of screening for the rest of the family members. But if you know to have family history, it may be reasonable to screen rest of the immediate family members.